Hi, do you face a problem while shaping curved canals? Do you used to have intracanal separated instruments while dealing with such difficulty? Well, I'll tell you the solution. Because prevention is better than cure, in a couple of minutes I'll try to show you how to avoid such kind of error while dealing with curved canals. Crown down technique is considered the gold standard in root canal shaping to minimize amount of accumulated debris at the apical third of the canal, also to minimize coronal interfaces and stresses on the files, especially the files that work apically managing narrow and curved canals. Starting by pre-flaring, mid-root shaping, apical finishing and cleaning, your file system should be selected carefully. For more than a year, I started to use the Essential Kit developed by Fanta in cooperation with Style Italiano and Bontes. Thanks to the revolutionary designed flat surface to minimize contact between the file and the canal wall while rotating inside the canal. With a double S cross section, the file maintains its cutting efficiency while being flexible. The hybrid heat treatment makes a whole difference, especially with the 13 taper 3 file, which is flexible by nature. Flexible because of being small in tip diameter and taper. It has some austenitic feature like stiffness and rigidity that allows the file to penetrate easily inside the canal, especially in initial phases of shaping. Going to larger size file, the files are more flexible to maintain the original canal anatomy and decrease incidence of file separation and transportation to the canal. This is the kit and I'll do the unboxing. Inside the box, you can find a guide on how to manage different clinical scenarios if the canal is wide, if it is regular, or even if it is narrow and difficult. It's like a small course inside. The kit consists of 5 files. The first one is K file size 10, 13 taper 3, 20 taper 4, 25 taper 6, and finally 35 taper 4. I'll show you how the hybrid heat treatment makes a whole difference in kit design. The 13 taper 3 file is very flexible because it has a small tip diameter and small taper also. But it has some austenitic feature to maintain its penetration ability inside narrow canals, especially in initial phases of shaping. But for larger files, they are more heat treated, so they are more flexible to maintain centrality of the preparation, also to prevent canal transportation and decrease incidence of file separation inside the canal. Let me show you a clinical case. This is a female patient, 20 years old, complaining of severe pain related to tooth number 37. From preoperative radiograph, we can notice that we are dealing with multiplanar curvature. In this case, I decided to do the pre-flaring using 25 taper 6 passively in the coronal portion of the canal. A little bit pressing towards the outer wall to gain more straighter access to mid-root and the apical portion. Now in the mesobuccal, we can notice debris coming out from the canal thanks to the off-center cross-section of the file. After pre-flaring and manual glide path, now I'm doing the mechanical glide path using 13 taper 3 file. A little bit stroking to the apex. Now in the mesobuccal, After working lens determination, I decided to end my preparation in the mesial route using 20-4 file, and in the distal, as it was easy and large, I decided to use 35-4 for apical preparation. Just make sure you go to the apex without any push. Now 35-4 in the distal canal, easy canal. And that was the result. Maintaining the centralization of our preparation, preserving anatomy, so we can have this kind of result. At the end, and as a conclusion, read and analyze the preoperative radiograph carefully, select the technique that's suitable to your case, plan your sequence of files according to case difficulty, and maintain your preparation centralized in the canal. So thank you for watching and see you soon.